Good afternoon, everybody. Thank you for joining us. This is our Ask the Docs series, and this is our 30-minute question and answer session wherein we pick up topic for each session, and we answer your questions on any orthopedic condition, treatments with the focus on cell-based therapies and regenerative therapies in treating musculoskeletal conditions. So the topic for today is tendons, tendon injury, tendinopathy, and it's one of the most common injuries that we see in clinic. Before we dive into the topic, I'm Dr. Mary Aumbach. I'm joined by Dr. Chris Rogers for this afternoon session. I'm going to have Dr. Rogers introduce a little bit about our practice before we begin.
Yeah, thank you again, everybody, for joining us. Dr. Aumbach and I are both board certified in what's called physical medicine and rehabilitation. So after we graduated from medical school, we decided that we didn't want to be surgeons, but we love orthopedics. So we specialize in non-surgical orthopedics. It's called physical medicine and rehabilitation. And Dr. Aumbach's much younger than I am, but she's very experienced.
Not much.
I've been oh my God, I graduated medical school in 1993. I can't believe already the time has passed so quickly, and it's very fun. We love to stay active. I'm a native San Diegan. San Diegans are very active people. We like to get outside. It's a real bummer to hurt and not be able to do what you love to do. So we're very passionate about helping people overcome these injuries without surgery when possible. We're not anti-surgery. We know there's a role for surgery, but it's probably not necessary as much as previously was thought. So we're trying to, together, Dr. Aumbach and I, and Dr. Diaz will join us on a future call, are trying to push this field forward, which is to help you heal these injuries without surgery, without cortisone injections, and using predominantly cell-based therapies, something that we call orthobiologics. Everybody knows they have the innate ability to heal. I think everybody here maybe has had a little cut or, injury that healed itself. And, we don't usually give a second thought as to how that's actually happening. We're now living in an era where clever scientists are figuring out what it is in our body that helps us to heal. Whether it's stem cells or platelets or other types of cells or other orthobiologics. And we're learning how to turn that knowledge into clinical therapies that we already offer here in San Diego.
So for those of you who have attended our sessions before, you know what to do. There is a Q&A, small Q&A button at the bottom of your screen, and you can start typing your questions regarding our topic: tendon injuries, cell therapies, PRP, procedures, regenerative procedures, all pertaining to tendon injuries. If you are joining us through Facebook, you can type your questions in the comment section and we can see that as well. And then we will answer your questions as they come. So what are tendons? Tendons are this tough fibrous structure that connects your muscles to your bones. And they're pretty strong. They stabilize the structures around your joint and around your soft tissue. And they can get injured pretty easily. The most common reason why these tendons get injured is overloading. And whenever we have repetitive injuries, for example, playing tennis or any different kind of sports, we strain these tendons. And I always tell my patients, these tendons are like ropes. You overuse them, and all these small fibers that comprise the ropes get frayed out. And if this fraying starts to become bigger and bigger, then you start to have a tendon tear. And then you can see that obviously in ultrasound and imaging studies like MRI. And when that happens, it can create pain, it can create inflammation, can create weakness because that muscle is not contracting to the best of its ability. And it can also limit your motion, your range of motion. So it's very important for us to keep our tendons healthy so that we can move properly and functionally. So one of the common treatments for tendon injury, first of all, before we go to the treatments, Dr. Rogers, can you give me the most common tendon pathologies that we see in clinic?
Oh, sure. So we'll just sort of work from the top down. For by far the most common tendon injury you'll see is in the rotator cuff tendon. And the rotator cuff is the area of the shoulder that stabilizes the ball into the socket and also helps with motion of the shoulder. And usually it's the tendon right on top, the supraspinatus tendon. That's a very common tendon injury we'll see. I always tell my patients, if you're 60 years or over and you go to your high school reunion and we do an MRI on everybody's shoulder, 2/3 of the folks are going to have some kind of tendon injury. It's just such a common area. And tendons, unlike your muscles or your bones, do not have very good blood flow by design, and which means that the ingredients that are necessary for healing are in low amounts in certain parts of the tendon, and those are the areas that tend to break down. They have less of a ability to regenerate themselves naturally. So as you know, your body's always trying to heal itself. You know, all day long we're breaking it down, and at night your body tries to build it back up again. Well, if you don't have the blood flow, if you don't have stem cells, if you don't have the ingredients you need in the tendon to heal, then it's going to take longer to heal, and it may not heal at all. But working our way down, we see patients who have injuries to the elbow, something called tennis elbow. We see tendons on the inside of the elbow, golfer's elbow. We see every now and then we do have patients who have a little tear in their wrist tendons. Working into the hip, a commonly misdiagnosed area. If your doctor's ever told you you have bursitis in your hip because it hurts on the side of your hip when you walk or go up and down stairs or sleep, lay on your side, it's generally not bursitis. It's generally a tendon injury. It's generally what we call tendinopathy or a tendon tear. Very easily seen on ultrasound or MRI, as Dr. Ambach stated. As you work further down the leg into the knee, if you just put your hand on front of your kneecap and try to straighten out your leg, you'll feel this little tendon pop up right below your kneecap, the patellar tendon. That's commonly injured in people who engage in sports that involve a lot of jumping, running, that kind of thing. And then as you work further down into the foot and ankle, one of the common tendons is the Achilles tendon, which is the big tendon behind your ankle that you can feel. But then there's also many other small tendons throughout the body that we will see that will sustain injury that result in pain that just doesn't go away.
That's right. So our body is pretty intelligent, and whenever it sustains injuries, it will start a cascade of events that will initiate the healing process. So it will try to repair tendon injuries, tendon tears in your body. Normal healing time is anywhere from 4 to 6 weeks. It could be up to 8 weeks. So your body will try to repair that. That's one of the questions. However, as Dr. Rogers has mentioned, because tendons and ligaments as well don't have a really good blood supply, we see incomplete healing very commonly. Which means that some patients still continue to have problems. They still have the tear. They still have the limitation in their functional activity, and that's where we come in. If you have failed standard treatments that include anti-inflammatory, a good course of rehab or physical therapy, and you still continue to hurt, then that's when we start considering injection therapies. And there's a lot of different injection therapies. You might have heard about cortisone injection. It's covered by insurance. It helps with inflammation and pain. It does help with inflammation of the surrounding tissue, let's say bursitis. Bursitis is an inflammation of the bursa or the sac that cushions your tendon and your bones. And when that's irritated and inflamed and you put cortisone into that region, it can help a lot with your pain. But unfortunately, the cortisone is not going to help with a tear, with a tendon tear. So that's when we start talking about regenerative therapies or these injections that can help facilitate healing of the tear. And we've got several options. The most common that we use is PRP, or a platelet-rich plasma. And a platelet is a blood cell that actually contains thousands of growth factors. And these growth factors, once we inject it into the area of injury, these platelets, once we inject it into the area of injury, release all these thousands of growth factors. And these growth factors are the ones that initiate repair of the tear. And we actually have a lot of good before and after pictures of these partial tendon tears that healed really nicely. And we have that in our Facebook and in our blogs and our website as well. Can you talk about cell therapies, Dr. Rogers, for tendon injuries?
Yeah, I mean, the science is very interesting, how these platelet cells, how stem cells, which I think most people are familiar with, what the actual biology effects are. So for example, I'll never forget the first time I saw a patient of mine who was a runner who had this tear in his Achilles tendon in his ankle. And about 3 or 4 weeks after we injected platelets into that tendon, not only could you see the tendon tissue get thicker and stronger, but you could also see little blood vessels forming in the tendon. And as you know, it's very rare to see blood vessels in a tendon. In a healthy tendon, you generally don't see blood vessels. The platelets released this, I call it fertilizer, these growth factor proteins that actually talks to a certain kind of stem cell that teaches your body or informs your body to make blood vessels, which then bring nutrients to the tear, which then allows the tear to heal. The interesting thing is once that tear was completely healed at about 3 months, the body knows this and it packs up the blood vessels and digests them and no more blood vessels in the tendon. Now you just have healthy, healed tendon. So that really, it was really exciting to watch that on our ultrasound images as we scan this tendon each week. But also it just speaks to the intelligence of the body. The whole healing mechanisms are fascinating, so, we're the field of regenerative medicine is still trying to figure out what's going to be best for a given condition. In general, if you have a smaller partial tear, like somebody asked, I have a partial tear in my rotator cuff tendon. Can it fully heal? Yes, I've seen partial tears fully heal with just platelet treatments. I've had other patients who have more stubborn tendons. Sometimes we have to add different kinds of cells. So we might take cells from your fat, for example. We may take cells from your bone marrow. These tissues have stem cells in them, as well as other types of cells that have been shown to be helpful for tendon healing. There's actually a really nice published paper out of South Korea where patients with full thickness tears, and this may shock you to hear this, but these patients had full thickness tears that were treated with stem cells from fat, patients' own stem cells from their fat, and showing that the tendon tear completely healed. So this is very exciting because if you talk to most orthopedic surgeons that are honest, they will tell you that the outcomes with surgery for rotator cuff tears are not very good. It's a very painful surgery. It takes a long time to recover. Even when the patient has recovered, they're not necessarily fully healed. So the idea of either adding stem cells to the surgery or replacing the surgery altogether with a simple injection is extremely appealing. More studies are being done. And I know of at least 2 other clinical trials that are going on right now, showing which types, how many stem cells, where do you put them? Do you do it more than once? There's a million questions that need to be answered, but the work is being done. And I'm pretty sure that anybody that has kids or grandkids right now probably will not have to go through rotator cuff surgery in their lifetime because the technology is moving so quickly.
Yeah, one of the downsides of tendon repair, for example, the rotator cuff repair, is there is a good amount of recurrence of the tear after the repair. And that's because at that tendon bone interface where the surgery is done, there's really not a good amount of blood supply to help with that healing process. So there's still a lot of basically a healing that needs to happen after a surgical intervention. And if the tendon quality is not great, that can still tear after. And we see these patients a lot in the clinic. About a quarter of these patients that undergo rotator cuff repair can still have persistent pain for many various reasons. But those are conditions that we can treat and help with. So there's a question here about, do I need another tune-up, or when do I need a second injection?
Waving the patty.
Yeah. The easy answer to that is if it starts bothering you again, if it starts to hurt, if it starts to affect your function, if you can't do your sports, you can't do the things that you love, you tried rehabbing it, you tried resting it, icing, take anti-inflammatories, and still persistent, then that's when we need to intervene. There's really no solid evidence yet as to what is the correct number of treatments or injections that we need to do for a particular tear, for example. So we really just individualize it per patient. We do have ultrasound. I'm sorry, go ahead.
I was just going to add, in our experience, patients often ask, how many times do I need to be treated? I would say the vast majority of patients, it's a single treatment, and that may be a little surprising. Matter of fact, there was an interesting study done in Australia that was presented at a conference recently, where patients had tears in the tendon of their hip, and they had a single PRP injection. And then these patients were followed for 4 years. So they had no additional treatment. They just had that one injection. And every year they would get a new MRI of their hip. And what was shown in that study was that the tendon continued to get thicker and thicker and thicker year after year after year, which tells you that the timeline of healing is exceedingly long. Now, those patients are getting benefit within the first few months. So they're feeling better, they're sleeping, they're walking, they're exercising. They're a clinical success, but biologically, they're still in a healing mode that was triggered by that one event, that one treatment. So I'm reluctant to repeat patients unless they prove to me that they're not responding as I would expect. And I think I can tell you, as a doctor who has been practicing this for a long time, if you have friends, say, for example, who don't live in San Diego, who might get treated by another doctor, you have to ask 3 really good questions. One is, how confident are they that you have a condition that will respond? We see many, many patients who want our treatments, but they're not a candidate. And that just comes from years of experience, knowing, for example, that if a tear is very large, is probably not going to benefit from PRP. You might have to do something in addition. So we call that patient selection, choosing the right condition and choosing the right treatment for that condition, customizing the care. The second part of that equation is a lot of doctors don't go through the extent that Dr. Ambach and I do in making sure that the platelet-rich plasma solution is customized for your injury. So we know, for example, in younger people, you don't need as many platelets, but for those of us 50 and over, you need to have a higher cell count. So we do cell counts in the lab. Actually, that machine, you can't see it, but there's a machine right next to me that we use to count cells right there. And that's our quality control. And I'm pretty confident we're the only group in San Diego that does that. So we know exactly what we're delivering to the patient. And then the third thing is, that these cells are put in the right place. So you need to do some kind of guidance. Typically it's ultrasound guidance for tendons to make sure that you're putting the right dose of cells into the right part of the injury to get the best result possible. And then I'm just gonna, while I have the floor, I'm gonna add that we're also big fans of physical therapy. We realize that just because your tendon is now healed doesn't mean you've regained your strength. A lot of people get deconditioned when they're in pain for long periods of time. So physical therapy is a huge part of the treatment. As you would imagine, nutrition is also a very large part. There's a number of studies that show that patients who are deficient in vitamin D, for example, or vitamin C or zinc, have more propensity to develop these types of tendon injuries. So we want to make sure that the tendon is getting the nutrients that it needs to heal. So it's no different than gardening. We need to make sure our garden has all the ingredients it needs to grow.
So there may be some instances wherein injection is not an option. For example, patients are just really phobic to needles, or they just don't really like shots, or they have a medical condition that would preclude them from getting the treatments. Let's say you've got active cancer, or you've got, a severe bleeding disorders, or any genetic conditions. For these patients that are not candidates for injection therapies, we have another treatment that is available in our clinic that's non-invasive. It's a non-injection therapy, and it only takes 10 minutes, 10 to 15 minutes treatment. And it's called shockwave therapy or a biowave therapy. It's a high energy ultrasound therapy that helps stimulate healing the same way as what the PRP does to our tissue, wherein it increases blood flow to the region, it helps with the pain, it stimulates healing. This is another option that we have. So I'll have Dr. Rogers talk to you about it. The machine is right next to him, and he can give you the spiel on biowave therapy.
Yeah, we're really excited to introduce this new technology, and we're just doing an introduction today, but we'll probably do some dedicated webinars in the future. But there's more than a decade and a half of published scientific studies that show that introducing sound waves into tendons, for example, but also broken bones, wounds, a number of different medical conditions can actually stimulate healing. Most people are familiar with shockwave in what they call low energy lithotripsy. So if somebody has a kidney stone, for example, they'll use sound waves to break up the kidney stone. This is a modified version. It's a simple device that looks like a ray gun. It projects a sound wave, very high energy. You can actually hear it. It's not ultrasound. You can hear it, but that generates a sound wave force that can transmit 6 or so inches into the body, which is really great for treating those deep parts of the body that are injured. And that will stimulate certain genes to turn on. It will stimulate the synthesis of certain proteins, things that are necessary for tendon healing. It's also been shown to be helpful for reducing pain. It's helpful for stimulating increased blood flow, a number of other mechanisms that are important for the types of conditions that we treat in people. This is new to us, even though it's been around in the published literature for more than a decade and a half. But we're directly linked to a lot of the thought leaders in the world, Dr. Noblock and some others in Germany, who've been using this for quite a long time with very good outcomes. And so this is a treatment option that we'll be talking more about in the future.
That's right. And although our topic is for today is tendon, this therapy, this is high energy sound wave therapy, is also used for joint osteoarthritis, for ligament injuries, and other musculoskeletal indications. So I know this is a question and answer session, but Dr. Rogers and I are planning to do a dedicated webinar wherein we can actually do a lecture on this specific treatment and give you all the science and studies and all the indications for this treatment. But it's a really cool treatment that's quick. It's 10, 15 minutes, even maybe less, depending on what your condition is. You can, go drive to the clinic yourself. There's no preparation for it. There's no downtime for it. No one needs to drive you. And it helps a lot. It has helped me. It has helped Dr. Rogers. We treated ourselves with it. It is quick, treatment, a fairly comfortable treatment. And we're really, really excited about it. So this is just one of those things that we can add to the options that we have to treat you if you have failed everything else.
Yeah, and as the question indicates here, it has been used for treatment of certain ligaments. There are different protocols that are being developed for different body parts, different types of injuries, so it varies. But that's for us to, know. But I think the thing that got me excited the most was we have a number of patients, for example, who have knee arthritis, and their arthritis is so severe that cartilage is completely gone. And we treat these patients with cell therapy from fat, typically with very good outcomes. But there's a subset of patients who have so much damage to their cartilage that their bone is actually damaged as well. You can see the bruising of the bone on the MRI. And this is another source of knee pain. And it's not just the knee, of course, it's other joints as well. And there have been a number of studies that have shown that by using we call it biowave. I don't like the name shockwave because it sounds like you're being electrocuted. but they call it a shockwave because it's kind of like, it's faster than the speed of sound. So you get that sonic boom. So they call it a shock. But anyway, so the biowave therapy has been shown in well-designed clinical trials to reduce that damage to the bone. And that's nice because traditionally we would have to inject something into the bone. We would inject cells into the bone or PRP, something like that, which is a invasive procedure, has to be done in the surgery center. So the thought of being able to do this in the office with a non-invasive option is very appealing. So we'll be studying that as well, but certainly for things like plantar fascia injuries, heel pain, Achilles tendon injuries, calcium deposits, in the Achilles or the rotator cuff. We've used it. I used it on my own hip tendon injury with good results. So anyway, we'll talk more about it, but it's just one more tool in the toolbox for treating tendon injuries.
Yeah, this technology was initially used to break kidney stones, and it's actually really effective in breaking up those small calcium bony deposits in your tendons, which otherwise, some patients would have to undergo surgery to just get it removed. So this one, you can get a less than 10-minute treatment and get those calcium deposits to smaller fragments. So we have about less than 5 minutes. So we'll take the last questions that you have. There's a question here about osteoporosis. Osteoporosis is more of a systemic condition in your bones, and it's not something that we inject a cell therapy for or treat it with this biowave therapy. So this is not an indication for regenerative treatments. Typically, your primary care physician or your endocrinologist will give you treatments, most of the time medications, to increase the strength of your bones and the minerality of your bones for that treatment. So
yeah, and specifically the question with regard to shoulder surgery, when they do the rotator cuff repair, the surgeon will put little anchors into the bone. They'll put little screws into the bone, and then the anchor has a little loop on it. And then the surgeon will use suture to tie the injured tendon to that loop. So it's not really a biologic repair, it's just sort of a mechanical repair. It's pretty rare that the bone would be so soft that the anchor would pull out, but I imagine it could happen. But that's usually for the orthopedic surgeon to let us know if that's a problem. But to your point, yeah, osteoporosis is not necessarily treated with the types of things we do. It's usually, diet and exercise and medication, and also identifying the cause. Some people, there's different causes for osteoporosis. So
we get a lot of questions with regards to downtime and recovery from the procedures. This is not surgery, as you know. These are injection therapies, so there's not really a lot of downtime. You'll probably feel a little bit more discomfort than your normal for the first 2-3 days. In some patients who have larger injuries or are more sensitive to pain, that can linger for about a week or even 10 days in some. But throughout this time, you're still ambulatory, you're moving, you're just not exercising or doing anything strenuous. So no physical therapy, no exercises or anything strenuous during the first week after the injection therapy, but you're stretching, you're doing some light walking. And then after 1 week after the injection, that's when you start your physical therapy or your rehab. So not a lot of downtime. Patients usually return to work, the next day, or it depends on what was injected. It could be a few days after. And one thing important about these therapies is they're not immediate in their effects. It takes time for these treatments to do its thing, to actually give you clinically significant results. So I think that's one of the things that patients always forget. They get the treatment, they call us after 1 week and they say it's not working. But yeah, it takes time for your body to heal. So the earliest results that we typically get from our patients is, it could be a month, but most of the time it's about 3 to 4 months before you actually see clinically significant benefits from it. So, just be patient with the treatment, you do your rehab, and then once it starts working, you're in it for the long term until you injure yourself again. So it takes time for these treatments, but really very, very little downtime to it.
We're getting a couple of questions about the cost of these various treatments, and it's individualized depending on what we do. So, for example, I saw a gentleman today who has multiple tendon injuries in his hip. That's very different than and we're doing PRP. That's very different than if patient has large tear that requires us to harvest bone marrow or harvest adipose tissue, take those cells, process those cells. The biowave, shockwave treatments are also not covered by insurance currently. And that also varies. So for, say you've had tennis elbow, I used to have tennis elbow, so I know what it feels like. It's painful to lift things, etc. Dr. Umbach treated me. For those of you wondering, I was treated with PRP by Dr. Umbach. It did not hurt. I did my exercises. I got better. I've had no pain in over 2 years. Thank you, Dr. Umbach. Of course, I whined about it for 2 years before I finally got treated. So I think that's the most common mistake we make, even yours truly, is that we just let these things linger for months and years. And we've had people come in, 20 years, I've had this pain. Clearly, if you catch it sooner, if I had only had pain in my elbow for, say, 6 weeks, 8 weeks, maybe 3 months at the most, I could probably get away with 1 PRP injection or 4 shockwave therapies, right? So once a week therapy for 4 weeks. If it's one of these injuries that's been around for more than 3 months, 6 months, a couple of years, now there's more healing necessary. It may take 8 treatments of shockwave therapy. Rarely does it take multiple PRP, but therapies, at least that's my experience. More than 90% of my patients just get 1 PRP treatment and they're done. Usually if it's a more significant injury, we're going to do something other than PRP, but 85% of our treatments are probably in the PRP category. And that range is about $1,600, I think, is our standard rate for that. It can vary. We do have specials once in a while. We do have payment plans and other ways to make it affordable because we realize it's expensive. But we also realize it's amazing therapy. Nobody else can really offer these things, and to actually heal tissue and be done and not have to worry about it anymore is tremendous. And so we're really happy to be able to offer these.
Yeah, if you have any specific questions about your condition, am I a candidate for it? Or, what's the cost? What's the good treatment plan? Just call us or email us or come see us in the clinic. And that way we can give you specific answers with regards to your condition. Unfortunately, we only have 30 minutes for this session. I wish we had longer time. But we do webinars, and those are hour-long sessions. And these webinars are actually lectures. You see slides, you see pictures, you see videos. Dr. Rogers and I go in detail with regards to specific topics. So if you do have any suggestions on what topic you want to learn from, feel free to email us or send us a message in Facebook, and we can tackle those topics. But that will be our next online event. It's a webinar, and that usually happens on the second Wednesday of the month. We'll send you updates through your emails or through our Facebook posts or to our blogs. So just keep in tune. But thank you for joining us. Thank you for your interest, and just keep posted. We do clinical trials. We always have something new and fun that's going on in the clinic. So keep posted.
And if you enjoyed this, we record it and then we'll put it on our YouTube page. So if you have trouble sleeping at night, I tell my patients, go to YouTube, type in San Diego Orthobiologics, and you'll see there's like 30 or 40 videos on there, and you might find one of those other topics to be interesting to you, or you can share them with your friends, whatever you like. So we make those available to you so you can learn.
All right, that wraps it up. Dr. Rogers, any last words?
Get outside, get some sunshine. It's summer, and be active, but don't hurt yourself.
All right. Thank you, everyone. Till
Take
next
care.
time.
Bye.
Bye-bye.